So I'm going to do the next presentation. My name is Mamello Thinyane, and I think maybe to continue on Araba's key finding that it's complicated, I'm going to probably continue with the complication, but particularly focusing more on issues of data and the use of data towards SDGs, but also towards specific SDG 3 health and well-being imperatives. The quick outline of the presentation is I'll talk a little bit about the SDGs, in particular the role of participation. How do we imagine citizens participating within the SDGs, and the role of data within that? Because even though everyone talks about the data revolution and about how data is important for SDGs, once again, it's a lot more complicated than that. So basically digging down a little deep to understand what are some of the data issues, how is data actually used to support both the SDG indicators monitoring as well as action towards the SDGs. And then I'll spend some time, of course, particularly focusing on digital health. The work that we do, I'll introduce our institute in a second, but the work that we do typically focuses on how does technology and how does data benefit individuals and citizens. So this is why the particular focus of this presentation is on personal health informatics, particularly to understand how do individuals use data in their everyday towards their own health and well-being, and of course linking that to the broader global issues around SDG 3. A lot of the work that we do typically is quite interventionist, so there's always a technology development or intervention that we undertake in our research. So I'll talk a little bit about this tool that we've developed, particularly towards enabling individuals to use their personal health informatics, and also possibly exploring how that can then be used to contribute to the SDGs monitoring, etc. And then I'll conclude by some issues and considerations. Just a quick overview of UNU-CS. I don't think we've done this introduction, but essentially we do work in the space that's ICTD, or ICT for development. Currently we have three main thematic areas where we undertake research. So we've got equals research that Araba has mentioned now. Broadly, that thematic area is around gender and technology. We have work that's framed around migrant technology, just understanding how do migrants use technology to enhance their structural agency, for example. One of the big projects there is looking at issues of human trafficking in the Thai fishing industry. So we've got projects happening there. And I'm involved in the data and sustainable development research area. It used to be called the Small Data Lab, and I'll explain a little bit later what we mean by small data. But particularly here, we're interested in how does data actually contribute at a global level towards sustainable development, and of course, a lot of issues in that. So, of course, we are all aware of the SDGs. I really enjoyed the presentation this morning about the foresight exercise, because for me, the SDGs actually represent one of the biggest global foresight exercise. I mean, they represent what we, the people, our aspirations are in 2030, right? One of the key things that came up from this morning is that those aspirations and those dreams actually can only be achieved with commitment, right? So commitment from different stakeholders. And my view, quite strongly, is that participation was always meant to be ingrained within the SDGs. I mean, SDGs were never meant to be a UN exercise or even a government exercise. It's actually meant to be an all-of-society engagement where citizens, CBOs, NGOs, companies are involved in achieving all these goals. And so I'll talk a little bit here about participation, because for me, fundamentally, one of the key critical things that we need to get right with the SDGs is the participation issue. We know that, of course, the mantra of leave no one behind typically is used quite a lot, but unfortunately the way that it's used is to refer to the idea of leaving no one behind in the indicators. So let's make sure that we account for everyone when we collect data about them. But I believe it goes beyond that. It's actually about, particularly around SDG 17, right? It's about actually engaging and partnering with all these other sectors of society towards achieving these goals. So even when we think about digital health and health outcomes, it's about how do we partner with, health providers, how do we partner with individuals, and how do we have this all of society approach towards achieving some of these SDG 3 aspirations. And particularly, the issue of participation is about the enjoyment of benefits that come out of the SDGs. It's not so much that we're able to count everyone, but realistically, to what extent are people enjoying the benefits of development? And I think this is an area where, if you think about the indicators, particularly the indicators, they are framed from a point of view of understanding to what extent do governments, for example, provide some of these services, to what extent do governments invest in certain infrastructure projects, etc. But if we start to think about indicators from the point of view identifying extent to which individuals enjoy the benefits of development, then you start to talk about a different story altogether. I've put this letter of participation. It's an old letter that was developed in 1969. It's still very relevant even today, because if you think about what does participation within the SDGs look like, I think ultimately we're interested in a point where we have real engagement and participation, right? So citizen control, citizen participation, not sometimes the point of just collecting data about people and saying, that's okay. Are they actually engaged? Are they involved in some of the action towards the SDGs? So I keep this in mind because this is actually quite the motivation for a lot of our work. We're trying to understand how does technology even facilitate the greater participation of individuals, of citizens, of community-based stakeholders towards the SDGs. And of course, I'm going to discuss that in the context of SDG 3, which is on health. So I'm going to talk about two ways, if I just swing over to data. There's two ways in which the use of data for SDGs is understood. One is clearly around indicators monitoring, right? This chart, which I think is quite nice, it comes out of the Global Partnership for Sustainable Development Data, where particularly it recognizes that even though traditionally the NSOs, the National Statistics Offices, have been the custodians of all the indicators data, but increasingly you're starting to have other stakeholders and players coming into the indicators monitoring and generation of indicators. So very clearly part of the evolution of the national statistics systems is that you're going to be increasingly getting more diverse set of stakeholders and actors generating data for SDGs. In particular, my interest is around the issue of citizen-generated data. So to what extent can citizens generate data that goes towards supporting the monitoring of SDGs? I mean, if we come back to some of the issues that Araba talked about now, can we engage citizens and individuals actually towards monitoring their own achievements around digital gender equality, for example? So I think in terms of where things are going, they are not there now, and they're probably not going to be there in the next 5 years. And part of the reason why they're going to take a while to get there is because things take time. I mean, this community is the statistics community within the UN, within the different countries. They have their own set of 10 principles of official statistics. They're going to take time before we can start ironing out issues of data quality that come out of this other different stakeholders. So this is one way that data is used. Data is used to support SDG indicators monitoring. Secondly, Araba talked about this already. I can skip that. So essentially this is just highlighting, Araba talked about those 3 tiers of indicators. It's always interesting just to see how many gaps are there. So as you mentioned, tier 1 indicators are the ones for which we collect data and we have very good methodologies around collecting the data. Tier 2 and 3, essentially, 1, we don't have good methodologies, or countries are not consistently collecting data around that. So you can really just see from this diagram across all the 17 goals, you can see what massive gaps are there. So around gender, as Araba said, you can see a lot of the indicators are in tier 3. I mean, these are indicators for which there's no data, and equally there's no good methodologies to collect that data. Interestingly, around SDG 3 on good health and well-being, you can see quite a lot of the indicators are actually in tier 1, so there's quite a lot of good data that's already been collected. There's still some in tier 2 and tier 3. The overall picture, just to give you a rough idea, there's about 230 indicators altogether. In tier 1, I think there's about close to 90 indicators. Tier 2 is about 80, and tier 3 is about 50 or so indicators. So there's a massive gap that exists in terms of data to support SDGs monitoring, and that's particularly why even the UN statistics community and the NSOs, they're interested in understanding how do we use big data to fill the gaps, how do we use satellite data, how do we use citizen-generated data towards this. Ultimately, of course, all of this goes towards the standard value chain. This is a value chain for SDG indicators. It's about how does the data that we collect lead to specific impact. I'll just skip through this very quickly. So the second way that data is used within the SDGs is particularly to support action on the ground towards the SDGs. And I think this is the one area where later I'll be talking about personal informatics and how individuals use data to support action towards the SDGs. We developed this to articulate how we like to think about data for achieving the SDGs. Right, so you'll see that on the far left, we have the standard information value chain. I think at a simplistic level, we can always assume that data, of course, leads to more information, information leads to action, action leads to life outcomes. But it's much more complicated than that, and we actually prefer to use capabilities approach. I don't know how many of you are aware of CERN's work around capabilities, where essentially data, even at an individual level, at a community level, at an organizational level, data is a resource, right, which individuals, based on a whole host of factors, they're able to convert that into a capability set. Capabilities are basically a set of certain functionings and certain beings and doings, right? So it's not that having data in itself is sufficient. I might have personal health informatics data about myself, the same data Araba that has, but actually the way that we use that data could be completely different. So it's always important to understand, what capability set do different individuals have, what kind of limitations, so issues of skills, issues of marginalizations, social marginalizations, for example. To what extent are those inhibiting the ability of individuals to use data to achieve these specific functionings, right? And this comes squarely back to the issue of personal health informatics, right? Typically, we talk about how individuals should collect data about themselves, use these activity trackers, but to what extent are individuals able to actually translate that into specific health outcomes? And that differs from individual to individual. Equally, it's not just, of course, about individuals. There's also the notion of collective capabilities. So within a social group, within a social context, how does data support the translation ultimately into specific health outcomes? So I mentioned that we have this notion of small data within our group. Ultimately, the way that we define small data is that it is an approach to data processing which focuses on individuals as the locus of data collection, analysis, and utilization. So currently, a lot of the data is collected to be used by companies, to be used by NSOs, to be used by these upstream actors. But how do we actually use data primarily to benefit the owners of the data, right? And by the way, I use the word owners a little bit loosely because I know it's a complex issue, the ownership of data. But in this case, let's just assume the people who the data is about. How do we use that data and involve them in the analysis and utilization so that ultimately it increases their capabilities and their freedom to achieve however they want to live, right? And so this comes back to the issue of choices that was meant earlier about, what does digital gender equality look like? The idea was that actually no, it's not about having 50-50, it's about people having the choice to achieve the kind of functioning that they want to achieve the kind of being and doings that they want to achieve. So this is our goal. How do we use data and how do we use technology to expand people's freedoms and capabilities? And all of this, once again, it's within the context of this data ecosystem. I think at the back of our mind, back to what I mentioned earlier, it's complicated. I mean, there's a lot of players in the ecosystem. There's a lot of data sources, there's a lot of people who are involved in curating data, in the analysis of data. And we always have to understand this because currently the use of data is going to be in this context of this very expansive, diverse ecosystem. Two other principles and underlying ideas that we employ in our work is the issue of data justice. And the way that we define data justice, there's been a lot of literature that's been highlighted about data justice. It's about the fairness in the way people are made visible, represented, and treated as a result of digital data. This definition came from Lynette Taylor from 2017, and she talks about three key ways that are important when we think about data and individuals. So the issue of invisibility and visibility, having to do with issues of privacy, how people get revealed through the data that they share. So if you are online and there's digital traces that are collected about you, to what extent do you have control and able to decide what data do you want to make available about yourself? Engagement with technology, issues of discrimination and anti-discrimination. There's also been another work by Richard Higgs and Rankin just around data justice, where they define as the primary ethical standard by which data-related resources, processes, and structures are evaluated. Right? I won't go too much into the details. We can come back to that if it's interesting. But essentially, we're increasingly seeing this need to embed data justice, which are the social justice issues, both in the use of data, but also in the design of the technology solutions. And this is particularly more pronounced with regards to SDG 3 health issues, digital health issues. So our work is quite informed by these issues of data justice, small data as well. I'm just going to share this last one because this is the one that we've employed a lot in the development of technology solutions in our work. This was the work by Motia et al. They've defined this notion of human-data interaction. And particularly the three notions that they highlight are the issues of legibility, which is the fact that every time you use data, individuals need to be aware of what data is collected about them, how that data is being used, and by whom it's being used. Agency is about empowering individuals to be able to act and use the data. And negotiability, that's my favorite one because it recognizes the context specificity of privacy concerns. So you'll see data in the research that we did that, issues of privacy doesn't mean that in one context, if people are concerned about privacy issues, they'll always be concerned about privacy in all other contexts. So for example, in our work, we looked at how actually individuals are very happy to share data with their doctors and health providers. But if it's about sharing data with, let's say, NGOs or with the Department of Health, they're not as comfortable to do that. So different contexts dictate to what extent individuals are happy to share data about themselves and about their personal health data. So I'll move next to this part that discusses the research that we did within our lab, where we're trying to understand to what extent individuals happy to share data about themselves, what data are they using, and how do they actually use data to achieve some of these health outcomes. So before we do that, what is personal health informatics? I'm sure you have come across this issue. It's essentially data that personal and individuals collect about themselves with regards to their health. There's been a lot of work done, particularly from the information sciences and the computer science point of view. And some of the models, personal health informatics models, the famous one is this one. It's called the stage-based model of personal health informatics, which essentially says that people go through these 5 stages of using data for their personal well-being. So preparation, collection of data, integration, reflection, and action. Ultimately, it's about this action which either is a behavior change or leads to a certain health outcome. Now, this model has been criticized a bit for being too linear, in the sense that actually the process is a lot more iterative than that. And so the next model, which was proposed by Epstein, represents that a bit more in a linear way. So individuals don't just collect data about themselves and work through a linear process, actually it's more iterative. They go from deciding what data to collect about themselves, selecting the instruments and the tools to collect the data, and then they go through that whole process of collecting, integrating, reflection, and then changing behaviors. And sometimes, this is the key contribution from this, is that they go through a lapsing process and then come back again, right? And so, if we think about, from the quantified self field or from the personal health informatics, actually, it's a lot more complicated than just a simple linear process of people collect data about themselves, they change their behavior, and kaboom, health outcomes. It's much more complex than that. There's also work that has tried to identify what are the motivations and what are the reasons why people collect personal health informatics data. This was done through a survey where people were basically asked, what are their motivations for using activity trackers? And they found these 5 different motivations. So, towards achieving certain goals, towards documenting their lives, so in a sense of journaling. For some people, it was about identifying for diagnostics purposes. So, identifying links between certain phenomena and certain health outcomes. And there were those 2 which had to do with people were doing it because there were some rewards and some benefits that saw, some incentives that they get for collecting data. And for some people, just because technology is exciting. So if I can get a flashy, cool activity tracker, well, that's cool enough. I'm also one of the cool cats. I can collect data about myself. So for some people, that was found to be one of the reasons. So the work that we did in our lab, as I said, we're trying to understand these 3 main issues. So what's the current practice? What are people currently using in terms of personal health informatics? How are they using that data, but particularly what specific data are they using? What metrics, what indicators they're collecting? And even more importantly, what are their attitudes towards sharing that data? So are people happy to share their data? With whom are they happy to share their data? The research was done through an online survey where we did 2 ways of recruiting participants. One was virtual snowballing, and then later we didn't get enough participants. Later we recruited online participants through Question Pro, which is the platform that we're using. At the end we had about almost 2,000 participants almost, and we basically used both statistics, descriptive statistics, as well as template analysis to analyze the data. So one of the questions that we had in there was an open-ended question that said, what data do you use for your health and well-being? And that's the data that we analyzed using template open coding. So these are some of the responses that came on motivations for data use. Now you'll see a whole host of different reasons why individuals collect data about themselves. So going from monitoring my weight and exercise levels, I keep track of my BMI, my fitness track data keeps me on track, things like making sure to reach my daily exercise goals. I mean, these are some of the motivations for why individuals collect personal health data. So we looked at a whole bunch of this, and we observed at the end about these different key motivations, so key themes around why individuals collect personal health informatics. 1, for benefiting others, awareness and monitoring, to reach new goals, to maintain health and well-being, and of course for comparison and reflecting, to allow them to reflect on certain issues, and dealing with specific ailments. So if you go back here, you'll see some people who are saying, I'm diabetic, so I need to keep track of my sugar readings. These are some of the motivations where people use data towards managing a specific ailment. We then mapped this against, of course, the 5 motivations that I showed you earlier. This is just for interest, just to see that in our findings, in our data, we were not able to find those two motivations where people collect data for rewards and incentives and for the heck of it. No, actually, a lot of them align more with the directive, documentary, and diagnostics use of personal health informatics. We then went to the next part, which was actually trying to understand the data that individuals use. Now, if you think about the whole SDG indicator space, right? as I said, we've got the 230 indicators that have been defined already within the SDGs. But one of the big exercises within the SDGs is this whole idea of localizing the SDGs. If you think about this, this is almost like a hyper-localization of SDGs, because not only are we thinking about sub-national level, we're actually thinking about at the individual level, what specific indicators are people interested in, right? So things like BMI, psychological well-being, time spent exercising, weight, calorie count, height, etc. And at the end, of course, we came up with this cluster of the specific data that individuals collect about themselves. So it's a lot more complex than is articulated in the current SDG 3 indicators. So you'll see there people collect activity, so physical activity, walking, how many steps they've taken, running, exercising, these kind of things. Environmental data, physiological data and physical data, psychological data, as well as food-related data as well. Now the point is, this is the data that individuals say they use that towards achieving specific health outcomes. This is what for them is valuable, and this is how they use that data for their own health outcomes. In our work, we're interested to see as well, can this data benefit beyond the individual? For example, can you connect my personal doctor, my health provider, with my data so that they're able to provide better services based on my data, which I can decide how to share based on those data justice principles I shared earlier. So moving on, we also asked the question of how willing are you to share data with the following stakeholders? Now the reason why we asked this question is particularly because, as I presented earlier at the beginning, we're interested in understanding how do individuals participate within the broader SDG indicators monitoring. So the questions that we asked were framed around sharing data with your personal doctor, with your family and friends, with National Statistics Offices, that's the NSO, Department of Health, World Health Organization, and an NGO that works on health issues, including pharmaceutical companies. Right? These are the people within the health data ecosystem who might be interested in personal health informatics data, right? And by the way, in some cases, they already collect some of this data. So trying to understand what's the attitude of individuals towards this data collection. And the key thing that came out of our analysis, we did basically a correlation analysis followed by a cluster analysis using hierarchical agglomerative clustering. So you'll see that we have these three main clusters that came up. One is the cluster with just the health provider. And if you see in the next slide, individuals are very much happy and willing to share their personal health informatics data with their health providers. And then secondly, it's about sharing data with the third cluster. As you can see, that's made up of family and friends, right? So once again, this has to do with issues of social sense making. It's got to do with issues of social support. I'm sure these are some of the dimensions of health as well, where individuals are happy to share their personal health data with friends, with their family members, etc. And the group and the cluster that the individuals are least keen to share their data with, that's the one that includes NSOs, Department of Health, World Health Organization, NGOs, pharmaceutical companies. Now, if we think about, as I said earlier, citizen-generated data for SDG 3, we need to take this into consideration. To what extent are individuals happy to share their data, and what of their data are they happy to share towards SDG 3 monitoring? We then looked, I can skip this because this was looking at digging a bit deeper in terms of to what extent do these specific factors influence individuals' willingness to share the data, but I'll skip that for the sake of time. So from this analysis that we did, some of the key takeaways are that individuals are definitely, of course, willing to share their data, particularly when it's related to this primary utility that they get. So if they're able to get better health service from their health providers, they're happy to share that data. We can also see a significant role that's played by the community and the social networks around an individual. So individuals are happy to share data with their friends and with their families, particularly, as I said, towards these issues of social support and communal aspects of health. Privacy and confidentiality factors are not simple. The context dictates the privacy preferences of the individuals. So if the context is sharing with a pharmaceutical company or with an NGO that works on health in a community, that context is very different from sharing data with a health provider. So ultimately, no one size fits all in terms of data sharing for different stakeholders, and once again, the importance of context integrity. I then spent just a quick read through all the SDG indicators, just to understand whether there was any alignment between what individuals are interested in from what we collected here versus what's articulated in the SDG 3 indicators. Of course, I didn't expect much because these are formulated at the country level and actually formulated more for governments. But there are a couple of indicators where you can see how individuals could, with some aggregation and anonymization, contribute to data. So particularly issues on, so point number 3 and 4 there. So there's some indicators around monitoring lifestyle choices, so alcohol and tobacco use. That's one thing that in our data we found that people are actually interested in as well. And also around indicators associated with monitoring specific diseases, right? We also found that alignment. So these are the few areas where we potentially see the contribution of citizen-generated data towards SDG 3 indicators as well. As I said, this was the first stage of our research. All of this is always about trying to imagine what a technology intervention to support individuals might look like. And so the next stage of this work was then to take all those insights that we got about how individuals use data and to embed those into a technology solution. So we developed this platform. It's called MySD, literally for My Small Data / My Sustainable Development. And I'll show you some screen interfaces. All it is it allows individuals to collect the data that they care about, and we are able to generate the insights that individuals care about as well. And at this stage, it's still entirely about the individual. So we're not thinking at this stage about how that data is shared within the data ecosystem. So far, we've only developed to say, okay, these are the indicators that individuals care about, and how do you translate those into a tool that can practically be used to monitor your health and well-being, and therefore support you towards self-management of health and also towards achieving your specific health outcomes. This tool has been developed. It's already available on Google Play, although it's still on beta testing. We're going to be developing this further, particularly, as I said, towards understanding whether that tool can then be used to support the sharing of data, for example, with your health providers, with the hospitals, and these kind of stakeholders. But the key thing is that it allows us to actually, in a practical way, experiment with some of those data justice issues that I mentioned earlier, where we actually try to get individuals and people at the center of this whole process. So it's very participatory approaches, very human-centered approaches in the development of this technology platform. That's some screenshots of the same app that I indicated. So maybe just to wrap up a bit, some of the key considerations. I think ultimately, I like the fact that we're ultimately recognizing that we're working in a complex system. I mean, there's a whole lot of work that's been done around complex adaptive systems, and I think one of the key things about those is that actually enhancing information flows is part of how you're able to achieve better outcomes within these complex systems. So I think fundamentally the way that we see the role of data, both personal health informatics and SDG 3 data, is that it actually enhances these information flows that then lead to achieving better health outcomes for individuals and also at an aggregate level. There's, of course, issues of data provenance, which is about keeping track of the evolution of data. That's how you're able to, enforce issues of control, issues of privacy, etc. And as I said as well, citizen-generated data for SDG 3 monitoring is not so trivial. One, because the alignment with the specific SDG indicators is not very strong. There's probably about 3 or 4 indicators. But also because of these complex issues of privacy, confidentiality, etc. So it remains to be seen how this will outwork itself in the future. So to what extent can citizens be engaged in monitoring SDG 3 indicators? There's definitely a lot that they can do in terms of action towards the SDGs, but for the indicators itself, it remains to be seen how that outworks itself. And once again, there's always, of course, ultimately the issue of the quality of the data and the trust in the data as well. We have ignored some complex issues around digital health. For example, the fact that the empowerment narrative, this idea that digital health tools empower individuals, it's not trivial. As I said already, it depends on so many individual factors, social factors, structural factors. And unfortunately, if you look around the world, there's been tons of policies that are just pushed on the idea that technology empowers people to be, empowered patients or digitally engaged patients. And also the last thing which Arab and myself talked about is this idea of the ownership of data. I mean, data is not ultimately just my own personal data. We might actually even think about data as belonging to the person who collected it, right? So I mean, if it's my personal health data but was collected at the hospital, who owns the data, right? So I mean, there's this complex issues around ownership of data as well, which we haven't dealt with in this presentation as much. So I think, in a nutshell, that's some of the work that we've been doing in our lab. And overall, I mean, this is one area around SDG 3, but we're doing work across a number of SDG goals. Also, there's work around SDG 8 and 9, where it's a similar issue that we're interested in. We're interested in how does data benefit individuals towards achieving and enjoying specific SDG outcomes, and also how do we use technology to empower individuals to do that. So thank you very much, and I'm happy to take any questions. Yeah.
Thank you so much. Again, fascinating. I was wondering, you skipped a slide, probably that's where you covered some of this. I was wondering, in the different uses or values people set for the use of their health information, were there any differences between men and women, between age groups, between socioeconomic status? We did a little bit of, it's linked to your last point around sort of the empowerment narrative, and there's a bit, we did a bit of work on self-care, which is often linked to sort of digital technologies, and there's that same narrative of sort of empowering people to self-care. But there's also the risk to that of sort of abrogation of responsibility, but also this idea that it's going to cost the system less if we pass on the responsibility to individuals. And so there, I think there's a very strong equity dimension and trade, potential risk. So I was just, wondering if you had found anything in your data that pointed to any inequities.
So in our analysis, we didn't, particularly in this qualitative data, we didn't look at, any of the controlling factors, so age or gender. We didn't look at that. We just looked broadly at what are some of the key issues that people say are the motivations for using data. But I think to your point, I recently read an article which exactly was saying that, people assume that collecting personal health informatics is actually something that people would love to do. But this study was actually saying no. I mean, maybe some people feel intimidated by that. They feel, I don't want to take this responsibility of, collecting data about myself and that being a critical pathway towards my well-being. So it's not always a given that individuals want to use these technologies to monitor themselves, and it's a lot more complex, and I think it needs to be understood in a nuanced way. Yeah.
Just a quick question, please. We had is a group that does gender analysis, global data on gender analysis. And one of the group particularly in India, we're talking about, I can't remember the name that she used, but it sounds a lot like crowdsourced data collection.
Yeah.
And again, it was the idea that a lot of the gender-related, we don't have data, we don't have formal data collection systems to do the gender analysis. So what they were doing was trying to get the different sectors of the populations that they were working with to collect the data for them. So a brief example, for instance, is with they were looking at factory workers and in the women who worked as factory workers, and the factories didn't collect the data, so they used the workers themselves to report on injuries within their own. It sounded a bit to me like what in maternal health we call the sisterhood method, where we used women reporting to try and estimate maternal mortality.
Yeah.
Do you see any value in, or is there any sort of initiative that allows for less formal ways of collecting data to inform the SDG monitoring? Or is it purely on the base? I mean, what sort of proxy measures can we begin to look at, I guess is the question.
Yeah, so I think there's definitely a lot of work that's been done around proxy indicators. The example that I was going to give you is based on a project that I was involved with in South Africa before I came here, where it was in the context of social accountability monitoring, where we were trying to engage citizens to monitor government service delivery. And part of that has actually even been around monitoring health service delivery. So I think something like that, of course, provides a very rich, detailed data about things like access to services and availability of services. But sometimes it's very context specific, right? So I think data like that, yes, can be used to support SDG monitoring, but not the indicators. I mean, my feeling is that it's going to take a lot for NSOs and the UN statistical community. It's going to take them a while to actually start incorporating these alternative data sources into monitoring specific SDGs. So I think the way that I see the potential of that is that, we normally tend to think about this top-down, bottom-up data and how those support each other. So, I mean, the examples that Araba gave, where there's a lot of gaps in the data that they're looking at, can we use some of this bottom-up, very specific citizen-generated data to fill some of those gaps? So I think at the end of the day, it's about using both to get a more total picture of what's happening. So yeah, I see a lot of potential for that.
Tremendous breadth.
There's a lot. I feel like
it's everywhere that I wanted to sort of reflect on. But I think two things stick out for me, and one of them is when you were talking about participation and how can technology increase or facilitate participation. There is an aspect around connection, and you referred to it sort of in this sort of human-centered, this human dimension, and that sort of the impact on technology to not facilitate human connection, but actually disconnect human connection, because there's a reliance on equipment, and so there is that part of it which I think is particularly important in terms of that sense of social connectivity and well-being and health that arises from that social connectivity, because as human beings we do need that in order to sort of develop and maintain our sense of health and well-being. Has there been any sort of research around that piece, particularly given the increasing social isolation, the increase in suicide rates, in mental health. There's some work around exploring technology in that space, which is so important for this sense of community. And the other part that I was thinking of was the personalized data. What's the connection with the work on personalized medicine? Because we collect data, but that data has to be towards a purpose. So if I knew, and so I'm referring to whole genome sequencing and all of that, if I know that because of my gene makeup that I'm more susceptible to certain diseases, or that there's a possibility of me becoming ill because of exposure to certain environments, then in data like that would empower me then to make certain choices. So has there been thought about how this sort of personal data collection connects to then the choices I make about whether I maintain my health and well-being, and the choices that I make about what I do and what kind of decisions I make?
Yeah, so the second part, I'll start with the second question first. The one thing that I didn't highlight was that, so if you think about data flows, typically they go from individuals upstream to, let's say, these institutions or organizations that collect data. We are pretty much interested as well in how the data that's held by organizations and these entities, how that can be fed back to individuals to benefit them. I have a very personal example of that, which is that I went to a hospital, I did some imaging and some diagnosis, and I wanted to have the data myself, sitting on my phone where it's not going to tell me much, but it's pretty pictures and I want to see what my brain looks like. It's trivial, right? But I think there's a lot of ways where you can see how the data that's collected and sitting with some of these organizations who collect the data, how it can benefit the individuals. So it's one area that in our work we're also interested in. There's a lot that's been done around call data records, so mobile call data records that mobile companies collect. That's very rich data that can be used for a lot of interesting insights for individuals. So I've seen some work that looks at how do we get mobile operators to start sharing that data back with individuals. Sometimes it's framed in the broader context of what's called data philanthropy, but we would like it to be a much more systematic thing where they can actually share the data with individuals, ultimately to benefit the individuals. And to your first question, I've seen a lot of work done from the social media side of things. So in terms of technology enhancing this bonds and interactions between individuals. I haven't seen much work specifically on health, I must admit. But I think there's been quite a bit of work that looks at what's the role of technology to enhance some of this bonding and bridging dynamics between individuals and groups. So that there is some work around that. But once again, not specifically on health, and it might be interesting to see what's there around health. Okay.
I don't see anything from Tigges.
That's good for me.
Hi.
Oh, there's something. Hi. Hello.
Sorry, yeah, hi. I've just been following along. Thank you for the presentation. I think an area that you mentioned that was of interest and would probably be something that we at the UNU-IIGH would also try to explore a little bit more is the use of personal health data or data that's actually being collected by individuals themselves, and trying to better understand how this links with the facility-based information that's being reported, and how tools such as EMRs, that are managed by healthcare providers can interact in a way that still preserves the confidentiality with the women or with the individuals themselves. So I thought that was a really interesting part. I don't really have any particular questions, as I was just more kind of listening and observing, but that is one area that I think more research will be required. Right now, we've always been thinking about sending information to individuals and, like text messaging them, and blasting them with information. How does gender and accessibility to devices, et cetera, affect that? But then now we actually are trying to empower people to, use information, be more proactive in their health.
Yeah.
There will probably be more of a divide also happening there because it requires a higher level of health literacy also to be able to manage that. So just wanted to kind of echo and flag that.
Yeah. If I can just respond to that or maybe just comment on that, that actually is one area that we're looking to explore a bit further in our work. So we've got a specific scenario that we want to explore, which is, I hinted at it earlier, how do I share, as a patient, how do I share my data confidentially, privately with my health provider, but particularly looking at the technology solutions towards that. So I'm a computer scientist by background, so I'm particularly interested in what architectures and technology solutions actually allow us to embed some of those data justice principles that I indicated earlier in this exchange of data with your health provider or with a hospital. So yeah, it's definitely an area that we're looking to do a lot more work in that, and we see a lot of potential benefit out of that. So thank you for flagging that.
That's great. I think that is a future area that a lot of people are going into.
Yeah. Okay. Great. Thank you.
I have only one quick question. Well, I have 20, but now. I was just thinking in terms of citizen-generated data and collecting gender data. These motivations that you have, do you think that they apply to other content of data? Because when you're thinking about health, there's always a benefit for the individual. You're uncovering data about themselves that is hidden in some way. But what about something that is more open, that happen in terms of gender inequality? So people, an event that someone was harassed. And what is the motivation to report that data? That is data that people know. So it doesn't, from a personal perspective, the motivation is just to hope to solve the problem or others don't have the same problem. But it's nothing about uncovering something that the person doesn't know. And I think that's most of the cases in the gender-related data that is not in health. They are in two opposite positions in a continuum of giving information to people.
Yeah, so when we started this work, actually we were thinking about across the whole SDGs, trying to identify this data that is very interesting to individuals, actually across all the SDGs. We started with SDG 3 because we thought that's the one that most people care about, and it's about their health, etc. The key thing that comes from your question is that with citizen-generated data, you always have to think about what's the motivation then for them to collect the data. Because if they don't see the value for why they collect the data, they won't do it. Of course, you can try to incentivize them, but that's not sustainable at all. So a lot of the work that we do is always to try and link the primary utility to the individuals. What value can they get out of this data? And secondarily, how does that data then support, let's say, global action around monitoring SDGs? But I agree as well. Different domains and different types of data might have different requirements in terms of privacy and confidentiality, etc. And I think that's why it might be difficult sometimes to think of a blanket approach. You have to look at specific, individual cases, individual data, and what the requirements for.
Because I'm thinking crowdsourcing may work in terms of gender-related issues.
Yeah.
Because people want to know what's happening with the others, whether in terms of health, it doesn't work because it's private data, because they want to understand. So there's these different approaches that may apply differently.
The reason why I put this up is because when we were coding our data, one of the things that came up was this idea of people collecting data to benefit others. So almost this altruistic aspect of collecting data. And I could see that maybe related to what you're saying. So it's not necessarily that it benefits me, but maybe it benefits my community or it benefits other people. So for example, when we started thinking, we're looking at things like, wash indicators, right? Water and sanitation indicators. You can see how people can collect data about their community and access to these services. Of course, they benefit, but at the end also the community benefits as well. And if you link that to, it being resolved. So whatever service delivery issues is there, if we link that, close the feedback loop in terms of then the service issue being resolved, then people will continue collecting the data. And then can we use that to inform, SDG 6? Is that the one on? Can we use that? I think that's one way we can keep doing. I'll give an example of the work that we're doing in India. So we're working with MSMEs, so micro, small, medium enterprises. We work with the Department of MSMEs, and they wanted to localize the SDGs, particularly 8 and 9. And initially, the approach was to say, you know what, we're going to come up with these indicators. They came up with 19 indicators that they wanted the firms and associations to collect. And the idea was this data is going to be voluntarily collected. And one of the main things that we immediately said was, what's the motivation for them to contribute this data? And so the work that we do in there is to identify some of these pathways to impact that directly benefit the MSME firms and associations as the primary dynamic, and then the secondary use of that data could be then to support the department, etc. So it's a similar approach that we are using in different areas. Ultimately, my data benefiting myself and then being used to support the SDGs.
Thank you. Yes.
Great.
Okay, one question from us here. Yes.
If you just maybe, what about family data? Because I think sort of this individual data is very, may I say, a Western concept, because we live in families, and so there may be data that is relevant to everyone, particularly if it's around food and nutrition, and has any thought been put into that?
So we recognize that, which is why, for example, we talk about this idea of collective capabilities, I mean specifically around health. My general feeling is that some of that has already been done. So if you think about household surveys, which already focus on the family unit as the unit of analysis, and we wanted to take it a bit further than that to say, actually at an individual level. And by the way, something like the capabilities approach that we use already gives quite a lot of recognition to these social issues and to these communal issues as well. But specifically in our work, our unit of analysis is the individual. But that's absolutely important and critical.
Is there potential to look at sort of some of these acts of family sharing where there's specific data that's being available to family workers? Because I think then it becomes, that data becomes a way of meaning and having dialogue within the family about issues that is relevant for everyone.
Yeah, so I think that notion of social sense making, actually, we highlight it quite a lot in a way, because actually some data might not even make too much sense as an individual data point, right? Only in maybe like, a context of a family or a context of a community might just start to see some patterns that actually make sense. So absolutely, that's critical, and it's one thing that in our work we definitely recognize as well.